Hello, everyone, and welcome. We are so excited and we thank you for tuning in to tonight's episode of Nest Builders. As always, we want to just extend a special warm welcome to all of our families, our teachers, and our school leaders who are tuning in from around the country. We thank you so much for being a part of our Nest family. February is National Children's Dental Health Month. And so tonight, in honor of that, we are joined by Dr. Modi from Infinite Smiles Pediatric Dentistry in Northeast Ohio. And she's going to talk to us all about children's dental health. Welcome, Dr. Modi, and thank you so much for tuning in.
Thank you. Thank you so much for having me.
You bet. Let's
um,
start with a brief introduction. Go ahead and tell our audience members who you are and talk a little bit about Infinite Smiles.
sure. So my name is Shreya Modi. I'm a board certified pediatric dentist. And what that means is after dental school, I completed a residency training program specifically in pediatric dentistry. And my office is Infinite Smiles Pediatric Dentistry, located in Solon, Ohio. That's like Northeast Ohio. I'm a mom myself to two boys. My practice sees patients from birth to 26. The exception to that is we do have a small percent of our patients who have special needs. We also have seen an increase in sensory needs since COVID. And so we don't have an age barrier for any patients who have special needs. And we do have a sensory room in our office as well.
Amazing. Thank you so much for sharing a little bit about who you are and your practice. For anybody who is listening and is looking for some more information, especially our friends in the Northeast Ohio area, please visit Dr. Modi's website, www.infinitesmilespd.com, for more information. And with that, let's dive into tonight's topic, all about pediatric dentistry, children's oral health and hygiene. We're going to start sort of at the basics, at sort of, I guess, the starting point, which is overall health for young children, overall oral health, and the importance of oral hygiene. I do truly feel like there are so many choices when you think about oral health products for young children, from the toothbrushes we pick to the toothpaste we pick and the flossing, all of that, right? It can be really hard, I think, for some parents to know where to begin, right? What's the best stuff to get their child? So we'll lead with that, Dr. Modi. What is the best choice for young children?
Yes. So the number one thing that I tell my patients and their parents is any toothbrush that the child is going to allow the parent to use on them, especially for the younger patients. I think that there's so many different toothbrushes that are out there now that have Disney characters or cartoons, things like that the kids would love. The most important thing isn't exactly the actual toothbrush, it's who's brushing for the patient or how the patient's brushing if they're old enough to brush themselves, and also what kind of toothpaste is being used. And I always tell parents that anything that has fluoride in it, we recommend for kids 6 months and up.
Great. And you mentioned independent brushing, right? Who's brushing their teeth? What is a good age that you feel like young children should start to be independently brushing their teeth and doing a good job at that?
Right. So I always say that a nice correlation is when kids learn to tie their shoes is when it's probably a good time that they can start brushing their teeth on their own. I will say that the number one place where we see cavities is in the back, in the posterior area where the molars are, and that is the area that kids are likely to miss and ignore when brushing. And unfortunately, that tends to be a part that is more prone to cavities. So I would say, I mean, for boys a little bit maybe older, I would say maybe 7 to 9, and for girls probably 6 to 8.
Great. Thank you so much. Now, toothbrushing can feel scary for young children at first, right? Putting this unknown object in their mouth and doing something that feels kind of funny to their teeth.
Right.
What are some good techniques that you can offer parents for their children, especially if they are apprehensive at first, or it's not a pleasant experience at first when they first start?
Right. So the first thing would be Giving the toothbrush to the child, not necessarily for them to be brushing themselves, but when we're at the infant toddler age range, we're always encouraging parents to just like have their kid hold the brush, feel it, kind of go around like their lips, go around their mouth, under their nose, just to get that oral sensation, and kind of get used to it. The other thing is, sometimes we'll do, like in my office as well, like role playing, like use stuffed animals and show how you're doing it on a stuffed animal before you start doing it with your child, and let your child partake in that so they can kind of be a part of the process.
Absolutely. Absolutely. It reduces the fear of the unknown a little bit, right?
Right.
You had mentioned you recommend fluoride toothpaste. I think you had mentioned 6 months and up, correct?
That's correct. Mm-hmm.
Is there any concern, and I ask this because I know when I think back to when my girls were this age and we were thinking about when to change them over to fluoride toothpaste, I was always concerned that they'd swallow too much of it. Is that a true safety concern, or how much would be a safety concern?
Yeah, so what we recommend is, in order to get like any level of fluoride toxicity, they would really have to take in a large amount. We're talking from birth through 3 years, or from 6 months to 3 years. We're talking essentially like what they call like a size of a grain of rice. And then after that, we're saying like a half or a quarter pea-sized amount. We're not using like large amounts. Kids would have to have literally a large amount of fluoride in order to have any kind of toxicity. We do realize that at that age, they're not spitting out, and that is perfectly okay. It's still, once that first tooth comes in, which is usually around 6 months to a year, we want the child to start having fluoride, because we do notice that without that, they're more prone to having cavities.
Great. That's super helpful. That's yeah, thank you so much. I want to ask you a fun question. I've gotten to know you a little bit before we did this. So tell our audience members the most unique person, or perhaps not person, that you have
I know.
done dental work for.
I think what Danielle is alluding towards is, so for anyone who's been to my office, what they'll see is we have giant posters blown up of pictures essentially of me working on different animals. And I have done dental work for a lot of the local police unit dogs and also zoo animals. So it's actually a great way to desensitize kids in my practice. It's a great icebreaker and conversation builder with the kids and the parents actually too. And so I would say I've worked on, I mean, my waiting room is filled with pictures of me working on gorillas, kangaroos, pandas, even birds, reconstructing a bird beak with dental filling material, monkeys. I mean, the kids see that and they're excited about their visit before they even get into the dental chair.
Absolutely. I will tell you, I was telling my girls about tonight and who I was going to be talking to. And my oldest is an animal lover. And so I said, oh my God, Amelia, you're never going to guess what Dr. Modi has done. And she was like, can I come on? And I'm like, well, there'll be no live animals.
No live demonstration.
You probably won't. It wasn't what she was thinking it was going to be. But thank you for sharing that. I think that's first of all, incredible work that you do, but also a great little tidbit that any parent coming to visit you could certainly share with their child.
Yeah, we have a welcome packet that we send to all of our new patients, and that is one of the things. We have pictures of that parents can show their kids before coming to the office for their first visit with us. So they get excited about that.
Amazing. Absolutely. All right. We are going to move into our next topic. But before we do need some help from our audience members. It is that time for our first poll question. And so for those that are just joining for the first time, you're going to want to leave your comments or your responses to this question in the Facebook chat or our YouTube comment section as well. So what is the biggest dental hygiene struggle that you as a parent face with your child or your children? Again, go ahead and put those comments, thoughts, feedback, all the things into those sections, and we will talk about a few of them here with Dr. Modi. While we're waiting for our audience to give us that feedback, let's dive into our next topic, which is healthy, or in some cases, not so healthy dental habits. I think one of the biggest ones that comes up, especially in these early years, right, is the pacifiers and thumb sucking. And for many parents, I was one of them. It's a struggle to it's a great tool when they're young, but it's a struggle to get rid of it or wean them off of it. So what is the right time to wean children off of pacifiers or wean them away from thumb sucking?
Thumb sucking. And that's always tricky. So it's always a sense of comfort for kids. But what I always tell my patients' parents is frequency and vigor is very important when determining how detrimental it might be to their jaw growth and their development. Sometimes we have patients that are thumb suckers, but the thumb is just kind of in their mouth and they're not actively sucking. It's more of a kind of a subconscious thing they're doing in their sleep. We don't tend to see a lot of like a V-shaped palate or anything from that because they're not actively sucking. What we try to tell parents is we look at the whole picture. What I mean by that is we're very patient-centric in my office, and we tend to have a conversation with the parents about what's going on in the home environment. Perhaps, there's lots of things. Maybe the child has changed to a new preschool classroom. Maybe parents are moving and they're in a new house, or maybe there's a new member of the family and, the patient has now a big sister or a big brother. Sometimes maybe parents are getting a divorce or grandparents passed away. We've heard a lot of things. And so that would not be a good time to try to wean a child off of something that they find comfort in doing. And I do kind of joke around with my parents and say, I've been doing this for 14 years and I've never had a child suck their thumb when they go to college or use a pacifier. And I always reassure them that their child will not be the first and whatever it is, we can fix and work with it. So I always want to try to talk and have that conversation with the parents about what's going on in the child's life and the home environment. And then if it's just one of those things where the parents haven't actually actively done a strategy, then we talk about different strategies. Some of them could be with pacifiers, which are easier because we can just take them away, is snipping the tip of the pacifier. There are pacifier weaning systems that some of the, that's on Amazon and some of the baby stores sell. And then there's also a polish that's very bitter tasting that's supposed to be for the thumb suckers. And I always tell parents that can also be used for obviously for thumb sucking too, but also for weaning off a pacifier if you paint the nipple of it with that bitter tasting polish. So those are some strategies. Another strategy for thumb sucking is they're kind of like large pajamas that have the mitts attached and the booties attached to it. So if a child wants to put their thumb in their mouth, they'd have to unzip out of the entire pajama to do it. Now, we have had some kids that still do that. So that might not be an effective strategy, but it's a start. So those are just some ideas for pacifier weaning and thumb sucking. Of course, pacifier weaning being easier because you can just take the pacifier away. Although I've had many parents ask me if I can chop off their kids' thumbs. So,
which we do not recommend. Keep the thumbs intact, please. Any kind of long-term impacts that you see, most common impacts, I guess I should say, that you see for the continued or prolonged use of pacifier and thumb sucking?
Yeah. So the biggest one being that their bite becomes more open and they're not closing down all the way. And the palate, which is the top of the mouth, instead of being flattened like this, it ends up being like a TP, like a V shape. And the narrowing, and we see that with both pacifier and thumb sucking, or we call it digit sucking, because sometimes we have kids that will suck their middle two fingers or something like that instead. So those are the most common things that we see. In addition, crowding and misalignment of the teeth.
Is there a point where if if parents are taking away or weaning off of these things early enough where it will maybe naturally correct itself?
There is basically what we say the earlier that the child can wean off or, I guess, really not use these as comfort and not thumb suck or use the pacifier. I guess the earlier the better because there's more chance for the jaw to self correct itself. But uh, it's not necessarily that's going to happen automatically on its own per se. But the window of time and in order to have the best chance of self correcting is when you can wean as early as possible.
Absolutely. Makes sense. Makes sense. A little bit of correction, but perhaps not total correction, right?
Mm-hmm.
We've got a couple of responses that I want to just touch on, some of those hygiene habits that parents are maybe struggling with currently with their children. The first one is getting children to use toothpaste. We've got one viewer who says their child does not like the taste at all. And I feel this viewer, my youngest, was like this. It took a long time to get her to like it.
Okay, great question. So sometimes it's not necessarily the flavor of the paste, but more so the foaminess or the burning that sensation that comes from a lot of the pastes. And so that material is called sodium lauryl sulfate. So there are some pastes that we recommend to parents that actually don't have that ingredient, but still have fluoride and are still effective to use on your child. So a lot of those brands, basically, if you turn around and you look at the ingredients on the back of the box, they're more in like a gel format and not necessarily a paste. So they're still a great paste to use on your kids, but they don't create that spiciness or that foaminess, so to speak, because it doesn't have the sodium lauryl sulfate in it. That's usually a misconception that kids have, as they say they don't like the taste of the paste, but it's really that burning, that sensation, that foaminess, and the flavoring is okay. I will say that there's lots of brands out there that don't have that ingredient, and they come in like wild strawberry or watermelon and all kinds of fun, mango tango, like all these flavors. So go ahead and try to find one or two that your child might like and try that and see if that works.
Great. Thank you so much. And then our next two coming in are all about flossing. What is the right age to start flossing with young children?
Oh, that's a great question. So a lot of this is mainly what I do is I say start at about 2 years old for the flossing, because that's when their second set of baby molars has come in. And the reason for that is, and my parents also laugh at me, because you want to start flossing whenever the child is, the earlier we start it, the better for the child, right? But the most important is, and I have this conversation a lot with my parents, is if your child is if brushing teeth is just not a fun part of the morning or nighttime routine, and I say this as a parent myself, then let's try, if flossing is a big, it's just really hard to do it for your child's not cooperative, brush the back teeth. At least try to get that, because those are the last to exfoliate. So those usually the child loses between 10 and a half to 13 and a half, sometimes up to 14. So I'm putting return of time on investment for the parents, because the front teeth, the child loses anywhere between 4.5 and 6.5, usually, typically. So we obviously are, the back teeth are going to be in there longer. Plus, they're the ones that are most likely to get cavities. So especially at 2 years old, when that second set of molars come in, at least try to get those 4 areas in between the last 2 teeth in the back of your child's mouth.
Great. Thank you so much. We got a couple more. I do want to get to these. We've got a couple more. One of them is about mouthwash, which I think is a great question. That I feel like, just from my own use, gives that kind of burning, bubbly sensation. So when should we start using it with young children? And then any recommendations on good brands, good products to use to make it as enjoyable as we can.
So definitely, I usually do not recommend mouthwash for children under the age of 6. And the reason for that is because of the whole swish and spit, just getting used to that. And we have some kids that are 4 or 5 and do that, and that's fine. But the biggest thing is obviously we don't want them to be swallowing it. Usually that has not been a problem, and parents have a good gauge on this in our practice. And sometimes they'll even practice at home. You know, if they can take a small cup and swish and spit water, parents will practice. It's how to do like the mouthwash at home with the kids. But what we recommend is something that has a non-burning sensation. One of the biggest ones in my practice is I always hand out coupons for ACT. And the reason for that is because ACT actually has a high fluoride content that is really great, that works well for kids. It also comes in a lot of fun flavors. So it's really good at prevention of cavities if done the way that kids are supposed to use it, which is swishing it for 30 seconds and then spitting all of it out. And then, of course, I always go over not to really eat or drink anything after doing the nighttime brushing, because we definitely don't want any of the snacks or anything that the child has eaten to stick on their teeth for the whole night.
Absolutely. Absolutely. Are there any other big dental hygiene areas for young children that you typically try to touch on and highlight with your parents that you can share with our audience members?
That we haven't discussed yet. Let's see. One of the biggest ones is how to brush a child's teeth that I get. And the reason is, you know, we get a lot of kids who just, the parents, especially in the toddler age, parents are like, you know, it's a struggle. And so once again, I kind of take off my pediatric dentist hat, put on my mom hat, and I kind of go over things with the parents. And especially at the toddler age, parents, first of all, parents need to be brushing for their kids, but also they don't necessarily have to be standing in front of the bathroom sink in front of the mirror in the typical fashion. You can lay your kid down. I always say a great time, especially in that 1 to 2.5 range, is diaper changes. If you're, you know, brush their teeth whenever you're doing the diaper change at morning and night. Another recommendation I have for some parents, and it does work for some of them, is I tell them if your kid loves bubble baths and takes you know, not doesn't do showers, but does like sits in the bathtub, brush their teeth in the bathtub, because sometimes kids are more compliant. So it's all about what environment the child is going to be most comfortable in. And then also, if it's not the diaper changes, if it's not the bathtubs, just lying the kid down. And I actually demo this quite a bit in my office. And one of the parents actually, I think, did a TikTok video of me doing this. I'm not technologically savvy, but she said this was genius and she wanted me to do a TikTok video on it. But it's really basically having the parents sit, put their legs in a V shape, and cradle the child between your legs and brush that way, because you have better access. And then once you do that a few times with your child, it actually becomes something where they're more comfortable with it, and it's not such a struggle then to do the morning and nighttime brushing.
Absolutely. Absolutely. How about for any parents out there who have children who are extremely resistant? I mean, tantrums and very upset in the process of trying to brush their teeth.
Mm-hmm. So that's where, yeah, I'm sorry.
No, go ahead.
Oh yeah, so that's where the technique of brushing with parents, essentially cradling their child's head between their legs and then putting their legs out and then kind of turning their bodies and keeping, if they're right-handed or left-handed, I'm right-handed, but just cradling their child's head gently and then getting in there and brushing. And the biggest thing I tell parents, and they, you know, and I laugh about it when I say it, is again, at this age that we're talking about, the whole 2 minutes, again, if we're talking about toddlers, 2 minutes is like 2 years in toddler land. So I always say, as long as the parent's brushing, try to keep it, you know, 10 to 15 seconds. And again, that's the mom in me and the pediatric dentist in me. So, you know, make life make life easy and just get all those areas. And that's plenty of time to get in there and get all the surfaces of your child's teeth.
Absolutely. Last question on this, and this is always a big one for myself with my girls. My oldest loved the electric toothbrush early. Like she wasn't, my youngest was actually scared of it for a while. I think just having that turned on. Do you recommend at any point changing to an electric, kids, certainly a child's type of spin brush?
What I always tell parents about that is I always say it's kind of like exercise equipment. Like, you know, my physician's always telling me whatever exercise that I'll do, to do it. If that means going outside for a walk or using the treadmill. So I always say, when it's time to pick out a toothbrush for the child, it's whatever they're going to be the most compliant with. And for kids, it could be, the latest Disney princess or action figure, or it could be that it's an electric toothbrush, and that's fine. What I would tell parents, though, is I always tell them if they're going to make that switch from a manual toothbrush to an electric one, don't go ahead and start off with like a $200 electric toothbrush, just in case your child, doesn't take a liking to it.
Yeah.
They do have some spin brushes and from Crest, and also Oral-B carries a Vitality brush that are $5. I think that's a small enough investment to make to see if it's something that your child is more cooperative with.
Absolutely. Thank you. Thank you so much. All right, we're gonna dive into the next topic, but we are going to ask our viewers to help us out again and share with us in the comments, what do you do as parents, as providers and caregivers and all of the sorts to young children? What do you do to help make dentist visits less intimidating and scary for your child? So any tips, tricks, all of those things, leave them in the comments for us. And while we're waiting on those answers, I want to dive into this next question and really start talking about visiting the dentist, right? Let's start very simply. When is the best time for a child to start going to the dentist?
Yeah. So a good way to remember is American Academy of Pediatrics and American Academy of Pediatric Dentistry are all on the same page about this. And they say a good way to remember is first tooth, first visit. That's assuming that, again, if we're looking at when should you just take your child for the first visit, no issues at birth. We do see a percentage of kids at birth, but that would be if there's feeding issues, failure to thrive issues. So with the exception of that, and generally speaking, we say first tooth, first visit, which is usually about 6 months to a year.
Great. And what are, from both your pediatric expertise, but also you're a mom of 2 boys, so from your parent expertise, what are some things that parents can do to prepare their child successfully for that first visit?
So what we do is, for new patients, we do have a welcome packet, and some of the things we talk about in that welcome packet are if the child can bring their favorite action figure or superhero or Disney princess or doll or stuffed animal. We've even had some kids bring cars. And what we do is we just pretend like the car has teeth or something. But what we'll do is we'll do a lot of modeling for the patient, because a lot of the tools that we use in dentistry is intimidating, but they don't hurt. And so a big part of our job is to desensitize the patient because we want it to be a pleasant experience for them. So what we do is we tell parents, we have things in our office that we can use as props. But if the child is bringing something that they're familiar with from home, it really makes a big difference, especially for that first dental visit.
Absolutely. Absolutely. And what can families expect? What can a first-time parent, let's say, expect from their child's first dental appointment?
Yeah, so depending on the age of the child, we'll take x-rays and also on the compliance and cooperation of the child. But basically, if we're in that toddler age, what we're going to try to do is try to get a cleaning, a fluoride treatment, and an exam. That's going to be across the board no matter what the age of the child. The x-rays are kind of like the rate determining factor based on age and also based on cooperation. Sometimes we do have kids, and again, dental visits are very intimidating. I always say blood draws, haircuts, eye exams, and dental visits are 4 things for a child that can be very scary because they last a little long and we're also kind of in their space, you know?
Mhm.
So what we try to do is, depending on the age, if they're younger and it's like their first visit, or maybe like their second visit and they're a very young patient, then it's just really getting them used to seeing me, getting them used to the dental chair, getting them used to the conventional dental environment, and introducing them to our dental tools and getting those things done. And then as they progress, then we will incorporate x-rays and things like that.
That's great. That's great. What's some advice, perhaps words of support that you can give parents who have a child who maybe has a negative, and not negative because of anybody's fault, but just a not pleasant first visit at the dentist?
We get a lot of patients that come as second opinions because they went to another dentist, didn't have a pleasant experience, and now they're trying it with us. And basically, what I like to say is the more you take the patients, the more they're going to really, really desensitize and get more comfortable with it. Sometimes what we do is we will actually tell parents if they would like, they can bring their child in prior to their appointment just to see the office and just to see the waiting room. We have fun colors and of the bright pictures and the animal stuff and all of that going on. So the kids then all of a sudden they switch from fear to getting excited about coming. And then, you know, now we have patients that are saying, I can't wait to go back. I can't wait to go back. And we have kids that are, you know, looking forward. 6 months is too long to go see Dr. Modi. So, you know, we really want to make it a fun experience. The other thing too is kind of letting the child dictate the appointment to a certain degree. And what I mean by that is sometimes, you know, the dental chair can be intimidating. And that's another reason why, you know, we do have a sensory room in our office, but sometimes we don't have to necessarily do things in the dental chair. And if it means that we have to have the child perhaps sit on the bench or sit in the parents' lap first, and we kind of go through some role modeling or show them some of our tools. I've even gotten in the dental chair myself and had the patient be like, hey, why don't you check my teeth? So we just make it fun. If there's older siblings, we will also have the older sibling be a model patient for the child so that they can see, you know what, it's not so bad, like visualizing that. And then just seeing, because the fear of the unknown is like the biggest fear for kids. So once they see it, that really makes a big difference.
Absolutely. I want to share some of the ideas, the thoughts, and things that our families, our viewers are doing, because I think they've got some. It sounds like our viewers are doing an incredible job prepping and really trying to make this a positive experience. So we've got some that read books about going to the dentist.
Mm-hmm.
They say still a bit of an issue. So I think a lot of the ideas that you gave were good, but keep reading those books, keep doing the role play. Some of them did talk specifically about bringing their child's special baby doll to let her pretend and do the brushing, talking in advance, so talking through what will happen and what it will be like in preparation for, but also in those moments. We've got some that have said most schools have hygienists come and visit the classrooms and talk specifically about oral hygiene. Some get little gift bags, which make children certainly feel excited and feel great about their, getting their own toothbrush and their own floss. And I know my girls love to get the little trial size toothpaste. It's made for their hands, right? It feels like it was made just for them. And then a lot of them are talking about several schools have the big giant teeth with the giant toothbrush that they get to explore. Any other last minute tips that you can offer that we haven't touched on yet?
Let's see. The other thing is on our website, we do have pictures of our office and some of the operatories and our waiting room. And that kind of helps because we kind of essentially tell parents to do a social story with the kids and using the pictures from our website as photos to kind of narrate what the visit's going to be like. A couple of my favorite books are the Daniel the Tiger series has a Visit the Dentist one, and I grew up loving the Berenstain Bears. And they have a Visit the Dentist book. And another one is Bear's Loose Tooth is another good one. There's a Peppa Pig book about the tooth fairy. So those are all really good books to talk about the first dental visit, or even when a child's ready to lose a tooth.
Yes. You mentioned Peppa's loose tooth and children losing teeth. Let's talk about that for a second. That was, for me as a parent, a dental experience that for my oldest was significantly traumatizing. She was very excited, but when it actually, I think there was so much anticipation building up to it. When it actually happened, I remember her being just completely stunned and just sort of like traumatized a little bit. How do you, anything that you can offer us as parents for sort of navigating that next season of life when teeth become loose, when they're okay to fall out, how to handle the aftermath? Because they, at least my girls, they bleed. My oldest, she bleeds when they fall out. That feels scary for her.
Yeah. So typically, and a big part of this is at that point when they're ready to lose teeth, the child should be established with their pediatric dentist and see them at least every 6 months. So that's a good way for their dentist to let them know what to expect between that visit and when they come back in 6 months for their next visit. But typically children, and it does vary by age, but I've seen as early as 4.5, and I've seen it, it could go upwards to 7.5 by the time they lose their first tooth. And I know that kindergarten, first and second grade is a big time when kids are what we call in mixed dentition, where they have some baby teeth and they have some permanent teeth coming in, and they got all kinds of different sized teeth in their mouth. One of the things that we go over with parents is when a tooth is loose, and this would be aside from if a child had an accident or a fall where the tooth actually flew out from kind of sports injury or something, but normally, like the normal exfoliation and typically speaking, those are the age ranges when children will lose their teeth. And it's usually the bottom 2 middle teeth that they're going to lose first. And again, we take x-rays by that point to kind of see when the permanent teeth are starting to come through on the x-ray, and kind of give a predictor to the parents, like, okay, well, Johnny's here, and I think probably by the time I see him in the next 6 months, I think he might, the tooth fairy's hovering, and maybe he might start to have these teeth be loose, or they might come out. What we also do is, if we know that a child is going to lose a tooth between the visit with us and then the next 6-month visit, we send them home with the treasure chest. Actually, that's meant just for teeth, and it's in the shape of a tooth, and they can pick whatever color they want, and it's just a fun way for them to put their tooth in the tooth-shaped treasure chest and put it for the tooth fairy, and kind of have that experience too.
Yeah, that's great. I will tell you, we have overcome that initial trauma. Her school also gives the treasure chest, so it became, I think she was in first grade when this happened. I sent her to school with a certain number of teeth, and she came home and had one less, and I had no idea it was even that loose. But turns out she was quite persistent because she wanted that treasure chest. So that is a good tip. Buy treasure chest. It is.
And I also joke around that because of inflation, the tooth fairy's paying bigger bucks.
This is true. This is also true. Buy the treasure chest and save up for the tooth fairy. That's for sure. All right, we are at that point, believe it or not. We're right about 8:45, just a couple minutes before. And so I do want to give some time to answer some questions before we wrap up. So I have some questions here that I'll start with, but certainly from our audience members, if you have additional questions, if you want us to dive into a topic or that we've already talked about, or maybe one we've missed a little bit, please go ahead and leave that in the comments. We're going to try to get to as many of them as we can. Let's start with what I have. And we on the topic of losing teeth, and you mentioned, obviously sometimes that happens because of accident, injury, fall, sports injury, etc. What happens in that case? What happens when a child's tooth gets knocked out?
We do see injuries all the time in our office, and get emergency calls too. And basically, it depends. One of the first things is we will get an x-ray, and we'll see, is there any damage aside from the tooth whenever it fell out. So if it's a baby tooth, we tend to leave the tooth out. And the reason for that is because if you put the tooth back in, then the permanent tooth will not come down when it's supposed to. And the baby tooth will actually cause, implanting the baby tooth back in will actually cause more harm. But for a permanent tooth, an adult tooth, like for instance, some of my teenagers that play hockey and don't wear a mouth guard, which I have to give them the whole mouth guard lecture then. Then what we'll do is we will replant the tooth. And a big part of success rate for that is to do it within an hour of when the injury happens. Luckily, in our area, a lot of the athletic directors and coaches are very familiar, and a lot of the school first aid kits also have the solution to put the tooth in until they can get to a dentist, or a lot of them know like what to do in that situation. A lot of our school nurses know that too. So timing is a big part of success for that. And again, that applies for permanent teeth. For baby teeth, however, like I was saying before, baby teeth get knocked out, and especially in the toddler age because they're running around everywhere. If they completely get knocked out with the root, then we leave it out and we take an X-ray and just make sure that there was no damage to the permanent tooth bud.
Absolutely. Absolutely. We're going to stay on the topic of losing teeth. Is it ever okay to help a loose tooth come out?
Yeah. I think there, believe it or not, there are times when I see teeth and there are in the mouth way too long. And it's funny how I see, especially like my middle schoolers, when they're losing those baby molars and they're in that 13 age range. It's funny how they'll go to great lengths to do anything but just take out the tooth. And I even joke around and say it's like flicking a booger out of your mouth. Like you'll sneeze and the tooth will come out. They don't want anybody touching it. So there is, at some point, parent intervention is necessary where you want to help the child. I would say that if the tooth is really, really loose, and a big indicator is also if you start to see the permanent tooth coming, then that's an indicator. Let's get that baby tooth out so the permanent tooth can come in right.
Mm-hmm. Absolutely. Is there a point where parents should be concerned that teeth are not falling out, right? I know you gave a typical range where that starts to happen and which ones go first. Is there a point that we get to that none of this has happened? We haven't, they aren't seemingly loose. Do we get concerned? Do we, seek additional support?
So for that, the best thing would be, again, keeping those 6-month visits with the dentist. And then also x-rays are important to see. Sometimes I do have kids where they're not losing teeth, and we do kind of get that complaint from the parents like, oh, Johnny's in 2nd grade and everyone else has started to lose teeth, and talk about the tooth fairy and he hasn't lost any teeth yet. And then we take x-rays and we kind of know, like, you know what, he's kind of like your late bloomer. He's going to lose them. Hang tight, be patient. But it's just, he's just a little bit dentally delayed is what we call it.
Is there any benefit? I feel like I've heard this before, and I'll ask because you're the expert and you'll know, I'm sure. Is there any benefit to baby teeth falling out later versus earlier? Is there any benefit to adult teeth or how they come in or anything like that?
So yes and no. I would say when it becomes a problem is when I was explaining earlier, when the permanent tooth is ready to come in, it's starting to come in, and the kid just does not want to flick the tooth out. That's when it's a detriment. But in terms of growth and development, and just if the child is a late bloomer, as we say, and dentally delayed, there's really, there's no harm or, anything to that. It's just, all kids are different and kids march to the beat of their own drum. One of the, I get this question a lot in my office. I actually get, when are they going to lose teeth? But I also get, my kid's 1 and doesn't even have a tooth in yet. Should I be, so this is what I tell all my parents. When we throw a bag of microwavable popcorn in, they don't all pop at the same time. Kids are the same way. Yeah. So think of it, so everyone's just different, and everyone's going to have teeth that erupt at a different time, and they're going to lose teeth at a different time, but it's eventually going to happen.
Absolutely. I love that analogy. I love that All right, so we have a couple of other questions veering off of the losing teeth topic. One is we're going to dive back into pacifier use. Can continuation of a pacifier have a serious impact on tooth structure?
It's more so not tooth structure, but what we call the occlusion, how the teeth go together, and how the jaw, like the formation of the jaw. But usually, what ends up happening is my kids that are pacifier users or thumb suckers, if they tend to do it for a longer period of time, and we're getting into the 4, 5, 6 year range, then what ends up happening is we have to put an appliance in to either help them to stop sucking their thumb, or we also later on down the road have to put what's called an expander. And what that essentially does is that V-shaped palate, it just expands so that way we can allow room for permanent teeth to come in. Crowding is a big issue that we see with our thumb suckers and pacifier users. But again, I also like to keep things within reason, because I have parents who might have a 1.5-year-old and they say, she uses a pacifier. Well, she's also 1.5. So I want to be within reason. And again, that's when I take my pediatric dentist hat off and put the mom hat on too. And we want to be reasonable. But I also get some where they're using a pacifier and they're 4.5 and 5, and they're going to go to kindergarten next year, and the parents are concerned about what other kids will think. Well, that's when we can have a discussion and talk about the strategies that we talked about earlier in the webinar, and just try to come up with a strategy that works for the family and for the patient.
Yeah. So up until that 4, 5, even 6 age mark, anything before that, you really just sort of take as a case by case, dependent on each child, what they've got going on, sort of situation, right?
And then sometimes I also tell parents to try the strategies that I give them, and then try it for a while and see. But I always use the phrase, if it's going to be like Black Hawk Down for a while, and I use that Black Hawk Down, then nothing is worth like stressing out the parents and the patient. But the reason I do have them try it is because sometimes we have, patients surprise us and they'll try some of the strategies, and trying it after a short period of time, it works. And so then it wasn't a problem to begin with. So I don't think it hurts to try. And then if it's stressful for the patient and for the parent, then we simply say, let's put it away and let's try it again in a few months, So we kind of work with the parents on a strategy, again, depending case by case basis.
Absolutely. Absolutely. Thank you so much. Do you recommend the fluoride treatment during every dental visit?
I do. And a big part of that is I know that there are some offices that will do, especially like at pediatrician appointments, they will do a fluoride treatment as well. One thing I would do is obviously mention that if your child is getting fluoride at their well child visit. But a big part of the efficacy of fluoride, those fluoride treatments, is doing it after a cleaning. And so when they're getting fluoride treatments, say at the doctor's office or at school by the school nurse, then it's not going to be as effective because they're not getting the professional cleaning. So we call it the biofilm. Removing that biofilm and then immediately putting that fluoride on is where it's going to have the most efficacy. Now, I do have parents ask me, then is it harmful to get the fluoride treatment by the school nurse or by the doctor's offices? And it's not harmful at all. It's not doing anything, but in order to get the most efficacy of it, I do recommend that after a professional cleaning, say in our office, to go ahead and get the fluoride treatment. And we recommend every 6 months, so twice a year.
Great. Thank you so much. Last one is, when can parents expect children to be evaluated for braces?
I get that question a lot. Yes. What we normally do is, so the 6 to 8 year is another like big, from in the dental world, developmental gap for us, where there's lots of stuff going on. So in that developmental period for us, we're checking for what we call the 6-year molars, even though they really come anytime between 4 and 8. But they're the first set of permanent molars that come in. And then we're also evaluating for braces. The number one question I get in my office is, when can my kid get braces? If I had $1 for every time that was said. Um,
That is the number one question my oldest asks her dentist every visit. I mean, that is, mommy, this may be the time he tells me I can get braces. And I'm like,
Um, so we usually start around the age of 7, just to evaluate. That doesn't mean that we're going to do braces at the age of 7, but American Association of Orthodontics recommends to at least get the x-ray around that age that goes around your head. It's called a panoramic x-ray. And what that does is it just kind of shows the formation of the permanent teeth that are still to come in. It shows the 12-year molars that haven't come in yet. So it kind of gives us like an aerial view, so to speak, of all the teeth. And that kind of helps us make a determination of at least, do we need to do some preliminary stuff and see how things go. So 7 is usually when I'll start taking that x-ray, sometime between like 7 and 8. And then we kind of go from there again on a case by case basis, because sometimes we do what's called interceptive orthodontics, where we just have to do some minor things. And just doing those things then prevents them from having full on blown braces later on down the road.
absolutely. And I know I said last question, but we have one more that came in, and I want to hear your answer to this one. Are you supposed to be rinsing your mouth out, or should children be rinsing their mouth out with water after they brush their teeth, or let the toothpaste stay on the tooth?
That to me, definitely it's indifferent either way to do that. I would say if they don't rinse their mouth, that's totally fine. And if they choose to, that's fine too. What I would actually say, kind of to add on to that, is people ask me when's the right sequence to do the flossing. And I always say the flossing should be done after the brushing, because leave the paste on. And then after you do the flossing, what the intent is to try to get some of that fluoride from the toothpaste flossing in between your teeth. So I'm really indifferent as far as spitting out and rinsing, so to speak. But I definitely think that the sequence should be after you brush your teeth. Definitely floss after that instead of floss first and then brush.
That's great. Thank you so much. Believe it or not, time flies when we're having fun conversations. It is time to wrap up this episode of Nest Builders. First and foremost, I want to thank you, Dr. Modi, for joining me tonight. It was an absolute pleasure. I learned a lot. It sounds like our audience members did too. So thank you so much for spending your time with us.
Yeah, thank you. And thank you for having me. And great questions.
Absolutely. Yes. A huge thank you to our audience members. Great questions, great interaction, led to a really fun conversation. I know I mentioned before, but you can learn more about Infinite Smiles Pediatric Dentistry and the work Dr. Modi does by visiting their website at www.infinitesmilespd.com. Or if you're in the area, Northeast Ohio, go ahead and stop by for a visit. I know I will be checking it out just the animal pictures and the work you've done there. In the meantime, everybody, mark your calendars. We've got our next Nest Builders event set up and ready to go. It will be on Tuesday, March 19th at 8 p.m. Eastern. We will be joined this time by Dr. Sabrina Bram from Stanford University. And Sabrina is going to be talking with us about how families can master the digital dilemma and create smart screen time. I'm very excited for this one. We're going to learn some practical tips and tricks and tools for navigating screen time and creating healthy relationships between our children and screens. You can learn more about this event and sign up by visiting www.thenestschool.com/nestbuilders. And until next time, thank you all for joining us and have a wonderful evening.
Take care. Good night.